Next, we have Professor Wang Haibo, Director of Big Data and Artificial Intelligence for Medicine at the First Affiliated Hospital of Sun Yat-sen University and Distinguished Visiting Professor at Tsinghua University. His topic is Preserving the Art of Medicine in the Age of Artificial Intelligence. A warm welcome to Professor Wang Haibo.
Thank you. Thank you, Chair, and thank you, Dennis, for your kind invitation. I was giving an assignment talking about the preserving the art of medicine in the age of artificial intelligence. If you put this line into GPT, usually it will return a word called humanity. And that is understandable because the scientific part of the medicine are increasingly dominated by AI. But today I would like to talk something that is not fully grasped by the AI yet. It's called the clinical reasoning. We all know large language model was created using human language, but human language is only the tip of the iceberg. So our thinking, our chain of the thoughts, many of them, much of them are not reviewed or documented in our language. So it's very reasonable to think the early version of large language model are lacking of the reasoning. So that actually is pretty much true in the medical documentation. In the medical records, we always document what we do, but we rarely document why. So that is very difficult, even with massive medical data, we'll have difficulty to train the clinical reasoning. Okay, that's actually promote the publication of this milestone paper from Google Research brain team. It's called the chain of the thought, which is a very simple idea. Instead of just directly ask the answer of the question, it forced the model to think step by step with intermediate, explicit reasoning steps. That is actually significantly increased the accuracy of the answer. So this is called the chain of the thoughts. Many of you are made familiar with this concept. The blue part actually is additional information contain the chain of the thoughts. Okay, now with many people stop here. They're happy with AI can provide reasoning, but that is not true reasoning like a human being. I will give you an example, show why it's the illusion of the explainability. So this is the CT result of one of my remote family, and she asked me about this coronary artery CT finding, and I gave it to DeepSeek V3, which is not a reasoning model, and which gave me a very good prescription suggestion. So if then I ask again, why you give this prescription, the DeepSeek V3 give us very good, a very plausible clinical reasoning because it's the cornerstone of secondary prevention of coronary heart disease. So it looks like a very good reasoning machine because they all call them reasoning machine, but it's actually not true. It's motivated reasoning, or we call it backward reasoning, which generating arguments to serve a predetermined conclusion. So it's still the pattern recognition. It's not reasoning. But if you move this part to this step, it will change the DeepSeek foundation model V3 to DeepSeek R1, which is a reasoning model. So it's only a change of the sequence is actually change the nature of the thinking. So this example shows the conclusion that most of the large model are doing the backward reasoning. It's not like a human. But sometimes the backward reasoning works. This is the most recent publication from NVIDIA about autonomous car driving. So they developed something called the chain of causality. It's very simple. They use 2 seconds of the video data to justify the action of the driver. So it's very useful and effective in improve the performance of the AI in the long tail event, which means rare event, and make the driving capacity reached to level 4, very close to level 5, full automated driving. So the question is, can medicine use this approach? Which is very difficult because when they do the 2-second analysis, actually they need to first define whether this action is correct or wrong. It doesn't involve accident, violation of rules, or near missing event. And in medicine, it's very difficult to define what is correct, what is wrong, because we can approach, we can have many pathways to arrive correct decision and wrong decision together. So the chain of causality is plausible, but it's difficult to apply that to the medicine part. So this is one of my research. We are doing the forward reasoning. At our research, patient is not a point, not a data point, but a curve, a journey. So if you look at the current state here, we identify the decision-making point here. So this part, and this part, the AI can generate multiple pathways, and which with constraints of the biological feasibility, clinical relevance, even social and ethical constraints, the hypothetical pathways collapse into the reality curve of the patients. This is very challenging and very difficult compared to the backward reasoning, because too less information you put into and too demanding for the computing power. Unfortunately, we have mathematical evaluations to help us to evaluate on these medical decisions, hypothetical medical decisions, which significantly decrease the need of computational power. And also, if you can do it mathematically, which means you can decrease the most precious resource, the attention of clinicians. You do not need a clinician to label the model data. And also, it can mathematically, it can help you to do the counterfactual evaluation, which means the same patient can go through different hypothetical pathways, and you can evaluate that based on the mathematical calculation. So this is a very difficult path, as I described, because the large language model are operating in a hyperdimensional mathematical space. There are so many possibilities, but it will land on the surface of the low-dimension reality, which need guided by the beacon signal of the physical world, which means although with mathematical help, we need huge amount of the real-world data to train it. But train what? We are not training an AI model can do the clinical reasoning. We are training a model actually can do the evaluation to decide what is right, what is wrong. If we can do so, and this is my last slide, we can realize the dream Neil and I discussed in last year, including the editor-in-chief of Nature and Lancet Digital Health. We talk about the cover paper of Nature is called Reinforced Learning Teaches AI Model to Improve Itself, Self-Help. Just like AlphaGo Zero is achieved on the history level of the Go power with only 41 days without any human data. So this is some of the research ideas, very complex research ideas. It's very challenging for me to share with you within 8 minutes, but I hope this opened the door for the discussion and the collaboration. Thank you again.
Thank you, Professor Wang.